Hello, it's Denise, and this is Ask Denise. And Sui has asked me to give her some help in working with some of her yoga students who have arthritic hips. So first thing I'll do is talk about what arthritis is. So the term arthritis means inflamed joint. And there's lots of different types. There's at least four major types of arthritis that you could have in your hip area. But I'm going to focus on the two main ones. And first one I'll mention is osteoarthritis. And that means that the cartilage is affected in both the joint capsule or the head of the femur here. And so it's the joint surfaces that are affected. And this can happen, they say wear and tear, but especially if that wear and tear happens in a poor mechanical position. So then one side of the joint may end up wearing out more than the other. In general, our joints don't wear out per se. What happens is they dry out. So that can happen if you don't move enough. And then the other thing that can happen is osteocytes migrate into the cartilage as we get older. But again, the way the body works is if you're using the joint properly, the cartilage is going to maintain itself, and there's less chance of that osteocyte migration, and there's less chance of those tissues just not being maintained because they're not being used enough. Right, so movement is very important for all of us. Now, if you have rheumatoid arthritis, is the other kind that's pretty common. That's an autoimmune disease, so it affects the whole body, not just the hip joints. And usually, if it affects the hip joints, it's both at the same time because it's an immune system response, and it's not as much affecting the cartilage at first. It's the synovial tissue of the joint, which nourishes and lubricates the joint. But of course, that's going to affect the cartilage over time if that area keeps getting inflamed and sort of succumbing to immune inflammation. All right, so I'm going to focus on osteoarthritis because it's usually a healthcare professional that would be working with somebody with rheumatoid arthritis. So with osteo, as I said, movement is really important. So let's try to help somebody who's got some osteoarthritis already happening, but they're not incapacitated because they're going to yoga. So who's going to show up in my class and what can I do to help them? So we want to improve the health of their cartilage. As I said, that requires movement. So what we need to do is get them moving without a whole lot of load, just as a warm-up. So I would suggest things like windshield wipering the legs, like this, just really gently, just to lubricate the joint surfaces. Even things like shaking the legs can be good. See, I'm not loading my joints at all, but this is going to really relax a lot of the muscles that might be trying to protect the joint. It's going to just lubricate my joint surfaces. So again, this is really simple little leg shaking mobilization. If you can get somebody to put some nice traction on your leg on occasion, if they are careful, that can be very beneficial. And then things like this, people don't think about this. We think about it for the shoulder, but not so much the hip. And that would just be kind of pendulum type mobilization. So just letting the weight of your leg gap the joint just a little bit, but that's very stimulating for your synovial tissue so that you get better lubrication and nutrition to those cartilage surfaces. And of course, you see this as movement, but because it's not loaded, it tends to be pain-free. So you can just get people to swing that leg out. Literally, it's going to make your leg feel a little bit longer. So good to do it on both sides. So those are a few little things to warm up the joint and get it prepared for movement, but then it is important to load because that's how tissues respond. You can also, use a little bit of myofascial release around, but that's not really the problem, okay? You can try this. If it makes you feel better and makes movement feel better, then definitely do it. All right, so from there, I'll show you a few exercises. You know, I'm a big fan of the little bridge pose for so many reasons. I would use a strap because what I want to do here is tap into my lateral lines. And, you know, I find a lot of people, if you give them a bit more muscle activation, then the joint tends to feel a little less compressed. All right, you literally start floating the joint surfaces in fluid, and it's a totally different experience. So I would recommend this. I'm actively pressing my legs into this strap, and I can just hold this isometrically. You can strengthen your muscles without moving them. All you need to do is contract them, and this does have an analgesic effect. Okay, so this again might make movement a little bit more appealing, we'll say. And then you can move into doing this with a movement. You can do it one leg if you start getting stronger, so we can certainly progress through that. So that's something that can be done in a yoga class. Other thing we can do in a yoga class is chair pose. But again, I would recommend using the strap so I get a bit more muscle activation. Remember, we want to strengthen so that the joint is supported, right? So we can, again, press into the band and hold isometrically. And then we, you know, when we get a little bit stronger, we want a bit more of a challenge, we can go into moving isotonically and pressing and rising up. So again, this just helps you increase the load. Now, once you get good at those, then you want to start working on single leg balancing. So you might have to at first start off with holding a wall or getting support somehow. But then if you can start working with your own stability. And here's something I would suggest, something like giving yourself some resistance here. It's isometric, so again, there's not a lot of movement, so that tends to be less irritating to the joint. And then I'm going to push. And you can actually give yourself resistance in all these different ways. Meantime, this leg is working to stabilize, and you're giving this side a little bit of priming, really. So I'm pressing, 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 and pressing. And of course, you can do that over a few breaths, and you can certainly do it somewhere where you can hang on to the wall or get a little bit of extra support if you need. And then, of course, working with single leg balancing and maybe even single leg squatting. So this might not look like a yoga pose, but I throw this kind of thing into my yoga class all the time. So I consider these basic, you know, training, conditioning, what have you. These are really important actions if we want to maintain our ability to walk. So another thing I would say, you know, with people that have arthritis coming on, make sure you get moving. Do movement such as walking. Make sure you're wearing, you know, good footwear for that. Make sure your walking mechanics are good. But movement is better than no movement. I mean, some movement is, certain movement is more nutritious than others. So keep that in mind. Remember, you want to mobilize the joint first so that everything's lubricated and it feels a little happier. And then work with isometrics. And then finally, isotonic. Isometric is where there's no movement. Isotonic is where there is movement at the joint. And really focus on strengthening. They don't really need to focus on flexibility per se. That will come once the muscles feel a bit more secure around the joint. Okay, sweet. I hope you can put some of that to good use. And thanks so much for asking the question. Bye for now, guys. I'll see you next time.